Hello friends. um, I'm making this video after a very long time because I've been recently been to a trip. I've been out stationed for say a week or so, so hence I couldn't make a video. I would like to apologize for that. So last time we had stopped on a certain topic. I hope you have seen my previous video of skin lightening, where I described the different creams that are given OTC. So in this episode, I would like to describe something about the creams that we give as dermatologists. So, like I described in my previous episode, I talked about retinoids, I talked about vitamin C creams, vitamin E containing creams, etc. etc. So, in this episode, we are going to talk about what creams we give as dermatologists. And to start with the list, first of all, whatever creams we give and whatever treatments we do as dermatologists, we give strong creams. We give very, very strong creams. Okay. And at times we also give a little bit, mild creams, moderate creams. So there are different type of creams that we give. It all depends again on what the patient's skin type is, what results would we want with the patient, whether the patient's skin is oily or if it's dry, um, etc. etc. So all of these factors we have to consider. Like for example, I had told you something about vitamin C um, containing topical creams, topical gels, and serums. So these products can be given only on a night basis, but again, if it causes stinging and burning, you should not use it. So this is somewhat a repetition of the previous episode. Hence, we as dermatologists, we make sure that whenever we give any cream to the patient, we make sure that the patient takes it um, with uses it with utmost care. And if the patient has any problems or troubles with using the creams that we prescribe, we tell them to give us a feedback. Okay, so it is, whatever treatment is done, it is done under supervision, it is done under a lot of observation, and based on how the patient responds within 15-20 days or maybe a month, then we change the cream or we keep the cream. We keep the cream with uh, means like we continue with the cream. Okay, so that is something about vitamin C. So similarly, there are also other creams in the market, like this creams containing kojic acid, there are creams containing niacinamide, there are creams containing several combinations also, but we do not give steroids. Okay, there are many creams in the market which claim to be glow creams, but they tend to contain steroids, and we as dermatologists, we are strongly against this concept of giving steroids, especially on the face for glow treatment. We do not recommend to give steroids. We do not give at all, we do not recommend, and we do not advise also to continue with any cream which contains steroids, because it can damage your face forever and there is no coming back from it. Any complications caused by steroid applications can cause a lot of trouble. Hence, the role of dermatologist comes in this. Now, I was talking about kojic acid, I was talking about arbutin, I was talking about niacinamide containing creams. So, these are the basic creams that we give. These are the mild creams that we give. Side effect profile is very less, but yes, it has to be taken under medical supervision. You cannot use these creams without medical supervision, otherwise they can cause side effects again, they can cause adverse effects and a lot of troubles in the future. So considering all of that, we give creams in a single formulation or with combined formulations. So based on what we want and what the patient wants, so we work it out and we customize the treatment accordingly, and we make sure that the patient comes back to us and we try to assess the response to the treatment. So this is just a brief idea of what we dermatologists do, so that there shouldn't be any doubt regarding this video that why this person doesn't want to clarify on what drugs dermatologists give. So I don't want to tell this because this is basically something that we have learned, the art of practicing dermatology, and it takes a lot of time to understand and to practice, okay, to bring that on a piece of paper in the form of a prescription. So please try to understand. And if you have any doubts, any queries, any questions, yes, you can comment, you can write down, and you can subscribe to my channel for further videos. Thank you. Goodbye.